So thank you for coming. We are going to have Heather and Jason here today, and they are going to talk about scar management. So I will let them take over and yeah, go for it. You guys can introduce yourself if you want. Go ahead. You introduce yourself first.
I'm Jason, the physical therapist here on the Burn ICU here at UC Davis Medical Center, and this is
I'm Heather. I'm a occupational therapy assistant on the burn unit, and I've been here about a year and a half, but I spend a lot of time working in outpatient hand therapy clinics. So I'm fairly familiar with scar management in the long-term portion. I don't know, what are we supposed to be? Just going over the slides?
Yeah.
Oh, okay. So just some basic information about scar management. Some things that you've probably already been introduced to as far as using lotion to massage the scars. Oh, I forgot my samples. There's also stuff called Dyson, which is like a blue or red kind of plastic material that you can use to massage the scars. And I forgot the sample, I apologize, but basically you take the little sample of Dyson and you use it to grip the top tissue of your scar to break up adherences. And also you can use a mini massager, which is pictured up in the corner. Use a little bit of lotion on that with a mini massager to help remodel the collagen fibers of the scar, soften them, make them more flexible.
does it matter what kind of lotion you use?
Any kind of lotion. Thank you,
You're
Jason.
welcome.
Any kind of lotion that you like is fine. To be honest, the cheap hotel lotions that you steal are the best. They don't absorb very quickly. They're kind of cheap and, not watery, and those actually work really well because you can use them for a long time before they absorb. Also silicone pads, which is the arm pictured with the little pad there. You can use those or silicone tape to help to flatten the scars. You can wear it at nighttime or during the day, on and off. It acts like a extra massage time. So at nighttime you can put it on and it's like massaging it all night to help that scar stay nice and smooth and soft. Compression garments, if you've been through a burn unit, then you were given compression garments, most likely. Also, there are custom compression garments that you can go to outpatient clinic to get. The ones that we're familiar here with in Sacramento are Enhance or Compression Obsession. And I'm not 100% sure. I believe just a referral from your primary care.
I think yes, I think the primary care, and I think the clinic can do it, but I think.
But if they're outside of the clinic, I believe your primary care can't give you a referral to those locations to receive compression garments that are custom fit to you. For contracted scars or maybe really old scars that are tight or becoming tighter over time, the most effective way is to do a very long stretch. So if you think of your scar tissue as a rubber band and you stretch it really hard once and let go, it bounces right back. If you wrap it around a newspaper, when we had newspapers, and you leave it on there for 3 days and you take it off, it's all loose and stretched out. That's kind of how our tissues are. So you want to give a nice long stretch to those tight contracted scars, 30 to 45 seconds up to a minute each time you stretch. You don't want to just stretch and pop it right back. And in the outpatient setting, if you have a very contracted scar and you go to an outpatient clinic, they might recommend a splint like we have pictured the red and blue splints up there. And basically those are splints that you put your arm in. There's a dial or a key that stretches and then it just holds you in that position for 20-30 minutes. And so those are some options for the longer, older scars that maybe just aren't improving by you stretching. The other way to stretch a really tight scar is to prop your elbow up on, sorry, I can't show in the picture. Give a support under your elbow, hold a weight or a dumbbell in your hand, and just let gravity help stretch that out and let it just sit and rest for about 20 minutes or so, and then gently take the weight out and bring it back. And then also for the older scars, laser treatments, which I'm not as familiar with. But I know that dermatologists do have procedures for laser treatment to help the color and the elasticity of those scars to decrease and become more flexible. And then, of course, moisturizer forever. Moisturizer is our friend. And all scars tend to get very dry. They want to crack a little bit. They become uncomfortable. So any moisturizer you like, cocoa butter, vitamin E oil, whatever your skin likes, keep those scars nice and moisturized. And we have a new joiner.
Okay, Richard.
I don't know what else with it.
I have a question about the silicone. How
Silicone.
long can you use the silicone pads?
Oh, you're
for?
so good, Jason.
How long will they last?
So silicone pads can be reused. They do tend to get a little dusty or dirty if they're laying around the house or if you've been using them consistently. So a little soap and water on the gel side, wash them, rinse them, let them dry out. And you can keep reusing them for a long time until eventually the silicone will start to disintegrate or not hold its shape so well, and then you might want to reuse them or recycle them and get new ones. But definitely they're washable. Soap and water. Yes.
A lot of times people ask where they can get those too.
So the silicone scar pads you can buy on Amazon. You can also buy them at pretty much all the pharmacies, CVS, Rite Aid, Walgreens. In the Band-Aid section or bandage section, there's usually a version of the silicone pads.
And one more, you gave an example of wearing them overnight, but is it recommended to wear them as long as possible, or is it just something that you should only do for a certain amount of time?
I would say depending on where your scar is, it might be hard to keep it on during the day. That's where you'll want to just massage and do some of those other things during the daytime. And they're nice to be able to put on at night, maybe put some Coban or something to hold it in place depending on the body part, and just wear it like through the night. And then during the day, you'll want to probably have it off just because it's hard to keep in place.
So I was going to ask, what's the best way to keep them on? And
Yeah.
then also, and sorry if you said this, if I was like a year out or further, is this something that would be good to be used, or is that too far out with scars?
So how to keep them on? There's a couple options. It really depends on the body part and where it is. If you have a compression glove or a sleeve, they can be inside the compression garments. If it's more like lower extremity, you can use an ace wrap or an old sock. You cut the foot off and pull it up to your thigh. It could be really anything that's not too tight or binding. And then the second part, how long? I mean, scars typically are mature around the 1 to 2 year mark, but I believe that if it doesn't hurt, it can only benefit. So I can't offer a study that shows it still works, but I would recommend, if it was me, I would still use them. They help keep the scar hydrated. They help keep it pressure on it to keep it flat, and they help to keep it soft. Hi, new people.
In the chat, someone asked if those kinds of pads come in bigger sizes.
They do. They come in a varying sizes. I'm not sure exactly. They also come in sheets that you can cut to the size that you like from some of the other vendors. But pretty much Amazon has a wide variety of things. You can also lay them side by side. If you only have a couple like small ones, you can stack them side by side to cover an area. Any
Thank
other
you.
questions, comments? Yes. Rich.
You have to unmute Rich.
You're muted.
I thank you for allowing me to come in late. So after I was injured, I'm grafted on both my legs. My left knee I'm down to fascia, and I tried using silicone pads initially under my Jobs garments, and they just didn't work very well on the flexure parts. but they were awesome when I would take it, when I would, so if this were my knee, I don't know if you can see this, but if this were my knee, it was easier to put the pads above the knee or below the knee as a protective measure, as I tried, because I was trying to also bring back my range of motion. They were awesome, but not on the flexure part. They just, either I just misapplied it or just didn't know how to, well, obviously I'd never done this before, but it was really tough on the areas of the body that needed to flex.
Yeah, and you didn't put it on. That's a common issue. That's also why it's hard to wear them during the day, because
Yeah.
if they're in areas that are bending, they're not designed to be super flexible.
I
So
couldn't
they're
even walk.
a little bit limiting. And also under certain compression garments that have more compression, they can be hard to get in place. But
Yeah.
I'm glad that you found a good solution that actually worked for you. So you did great.
It's the coping. It's what we learn, right? Is we have to make adjustments, but it was really good. And I just learned that I had limited walking abilities because it would start to slide, not slide, but it would just sort of move around.
Yeah.
But for the interim that I needed it to really press down on the graphs, they were awesome.
Great.
Yeah.
Good. Thank you.
I just love it. Thank you.
Anyone else have any other questions, comments, things they want to share? Yeah, go ahead.
Sorry for coming in late, guys. I wouldn't load on my computer. I've been having my lady use one of those massage guns, like the point. I have that point relief one. That never really did anything for me because my scars were so thick. I've been having her use those therapeutic massage things. I've been finding it's really been helping a lot. Do you think that might be doing too much damage? I'm almost 5 years out at this point. March 14th will be 5 years. I find it's been helping with my range of movement and actual like the tenseness and the tightening of the scars, especially during the cold. Am I doing any harm using that?
No, if it's working, it's working. I would just be careful to make sure, because those are very strong or aggressive vibrations. So as long as the top layer of your skin is maintaining integrity, you're not getting like any open or like sore spot. But 5
Yeah,
years,
no, none of that.
yeah, 5 years out, you're probably fine. I probably wouldn't recommend that for somebody with younger scars. It's a little too aggressive, but for 5 years out, as long as your skin is looking healthy and it's not irritating your skin, then yeah, you're probably
Yeah,
good.
no red spots anymore, no breakdowns. I mean, I'm healing rather fantastically, to be honest. We just use really good lotions and then that afterwards. So I just want to make sure that I wasn't doing anything that could be more damaging to myself.
Nope, just keep.
And good morning,
keep an eye on
everybody.
yeah, just keep an eye on your skin, and yeah, it sounds great. You're doing great. Thank you. Where did I go from here?
Anybody else have any other questions? Doesn't have to be about scar management. It could
Yeah.
be anything. Contractures.
Ask Jason something about PT.
How can we help? I'm a peer supporter. I'm Rich in name only, but how can we help
Same.
motivate some of the newbies to really be committed to, now that they're out of the unit, they sort of get lazy. Does that sound familiar? And how do we motivate them other than, showing them, look, this worked for me. Sometimes it just goes in this ear and comes out the other. Yeah.
If I had a magic answer for that, I'd be rich. I don't know, Jason, what are your ideas?
Yeah, Jason.
God, it takes a long time to get normal range of motion back, and you may not ever get to normal. It might be a new normal, but I would recommend that they go try and see someone. It's okay to reach out and get a PT evaluation. Hopefully there's an outpatient clinic nearby, or to address those deficits, so reach out to your physician and get that order just to see someone, and maybe they can work with you, because it's hard to do it alone, and oftentimes people you live with don't know what to do either. So
Nope.
We have folks that come to our clinic. We have a wound clinic, but they've never saw a therapist or never got any educational material. So there's material out there. You just gotta go find a therapist, a physical or an occupational therapist.
Would it be okay for Rich or the peer supporters, volunteers to ask me, and I can ask you guys for some certain exercises?
Oh,
Like if there's
yes,
some
always.
specifics?
Mhm.
Okay.
Yeah, we give a lot of materials out to our inpatients here at the hospital, but a lot of it is applicable. It's for when they discharge, so it's applicable to the outpatient realm. So if there is specific needs, areas of the body that are still limiting and range of motion and scarring, yeah, shoot Lauren a line, and she's like 30 feet away from our office, unfortunately. No, I'm just kidding.
Aw.
That's on
Yeah,
record.
yeah.
Jason.
And it's like anything. I mean, all of us know we're supposed to go to the gym and work out. How many of us do it all the time? Like, it's just human nature. Yeah, exactly. It's human nature to, struggle with all the things that we need to do and should do and don't always do. So we have to be patient with each other and just support each other and, keep reminding each other as a community how we can stay strong together and reach our goals.
And just because like it's the way it is, like your body is the way it is right now, and you just get comfortable with that, or you get used to the impairment, like the lack of flexibilities. Like, don't get too comfortable with that. You know how your body should move, or how people should move. Like, let's visit somebody to sort of get some ideas to address it. Don't get just complacent with how things
So-
are.
That is the magic word. Thank you. That's because you want to tell them, don't get complacent. You've been more flexible in the past. Why should you just give up now? And one thing I've tried and has worked for maybe half of my young peers, my newbie peers, is to encourage them to start stretching. So I don't use the word exercise, but I just start stretching, and then that gets them flexible enough that they don't fear that word. I don't know why, but they, when I say, hey, if all you can do is for 10 minutes stretch in the morning, you'll find that you can move around much better, and you'll reconsider what I was suggesting about going back to PT or finding a gym, and what you learned, what Jason and the team taught you. You can do that at your local Planet Fitness or whatever, but I mean, because I don't want to hold their hand, but it's like, I don't want to give up on them either. So I ask these questions because I'm always hoping for a new bullet or something new to tell them. But I'm just, it's a great reminder. About not being complacent. Yeah, thank you.
Sorry, they're working on the building.
I don't think this question comes up very often, but are there any like common tools that a lot of burn survivors use other than, the like the silicone pads and things like that? Is there like a lacrosse ball or a massage roller or anything like that are things that kind of help get people moving or into the process, even though I know obviously all the scars are in different places?
I say All of those, yes. Whatever motivates you to do it. So if you like the feeling of the massage gun, great. If you like a roller or a lacrosse ball because you feel it gets in the spot the best, yeah, all those things are great. And I encourage people to experiment, try different things, find what really seems to work for you, and then you're more likely to just stay with it and stay consistent. And it's trial and error, like all things. And also if you have a hobby that you like, there's your motivation, you know, to ride your motorcycle again, or, you know, go fishing or whatever it is. Find that thing and work towards that goal. Yeah.
Thanks, Heather.
Yeah, motivate them. Find things that motivate them. Thank you.
Anyone else have any questions before they drill a hole in my office floor?
Yes, yeah.
You hear something?
Or at the dentist.
Well, if you guys do have any further questions, you can always shoot me an email and I can send it to them. Or like they said, if you come across any burn survivors that need any extra assistance with PT or OT, I can get anything from them, some exercises. Cool. Well, thank you guys
Thank
for joining.
you.
Thank you.